Hi, my name is Deborah Hamilton, and I will be speaking to you today on autism. Have you or any of your loved ones ever encountered a loss of joyfulness from a close family member? How many of you ever felt a family member did not make eye contact or felt unresponsive to a wave or a goodbye gesture? How many of you ever wonder why? Are you familiar with a disorder called autism? ASD, Autism Spectrum Disorder, is a bioneurological developmental disability that generally appears in children before the age of 3, according to the National Autism Association 2014. It is characterized by difficulty in communicating and forming relationship with other people and in using language and abstract concepts. According to the website autismspeaks.org, ASD is characterized in various degrees by difficulties in social interaction, verbal and nonverbal communication, and repetitive behaviors. Building awareness of ASD and educating people about the symptoms, signs, and treatments is important in helping others identify and understand people with ASD. ASD affects millions of families in the United States. 1 in 68 children have ASD. 1 in 42 boys are affected by ASD to 1 in 189 times that appear in girls. It is the fastest growing developmental disability in the United States. It is important to understand what ASD is. To understand autism, one needs to understand how to recognize the signs. ASD affects 3 different areas of a person's life: social interaction, communication, verbal and nonverbal, and behavior and interest. Each child that has autism is affected differently. Some are delayed from birth, while others have sudden loss of social or language skills. Sometimes normal behavior is displayed until there is enough language to demonstrate unusual thoughts or preoccupation. The main types of ASD are Asperger's syndrome, pervasive developmental disorder, and autistic disorder. Rett syndrome and child disintegrative disorder are very rare disorders that are similar to ASD. No big smiles, no words, no social skills, no eye contact, non-responsive to their name or share interests in enjoyment or signs that someone has autism, according to the Center for Disease Control and Prevention of 2014. Lack of interest in sharing, enjoyment, or achievement, lack of empathy and failure to develop friendship with peers, and problem with developing nonverbal communication skills, such as eye-to-eye gazing, facial expression, and body posture are just some of the symptoms. There are a wide range of things to look for when trying to identify autism. The inability to initiate a conversation is one of them. Repetitive language and being unable to understand the listener perspective are also signs that someone has this disability. Autism is a person that may possess the following characteristics in various combination and in various degree of severity: inappropriate laughing or giggling, no real fear of danger, apparent insensibility to pain, may not want to cuddle, sustain unusual or repetitive play, uneven physical or verbal skills, may avoid eye contact, may prefer to be alone, difficult in expressing needs, may use gestures, inappropriate attachment to object, insistent or sameness, echo words of phrase, inappropriate response or no response to sound, spin object of self, difficult in interacting with others. Each person that has autism has a unique situation, which means the treatment has to be unique for each person. An intervention plan is used to address each individual need. Behavior treatments, medicine, both are used to the intervention plan. Authority training, vitamin therapy, trained therapists facilitate communication, music therapists, physical therapy, and occupational therapy are all used as treatment according to Cook 2012. There are health conditions that affect people with autism. Sleep disturbance, seizure, and gastrointestinal issues are some of them. Many times, treating these medical conditions helps treat the ASD. Medicine are used to treat conditions like depression, anxiety, hyperactivity, and obsession-compulsive disorder. Speech, occupational, and physical therapy are also used. Setting up routines and make changes to diet like limiting sugar and processed food intake can also help a person living with ASD. Studies have shown that there are several causes of autism. These causes include vaccination, environmental exposure, pesticides exposure, parental age, pharmaceuticals, freeway proximity, and limited prenatal vitamin intake. You would think that knowing what causes autism, people would do what is necessary to prevent it. But there needs to be higher level of awareness. Building awareness of ASD and educating people about the symptoms, the signs, and treatment is important in helping others identify and understand people with ASD. Thank you. Is there any questions? Thank you.